Hello, I'm Dr. Jenny Fox from the Institute of Health and Biomedical Innovation at Queensland University of Technology in Brisbane, Australia. We did this study because in recent years there has been much progress in treatment options for those with a diagnosis of advanced melanoma. Historically, this diagnosis had a very poor prognosis with a relatively short trajectory to death. But recent advances in immune and targeted therapies are leading to improved survival outcomes for some. This study is among the first to explore carers' experiences and builds understanding from this perspective. We did the study using a qualitative exploratory design, which is well suited to exploring in depth the perspective of bereaved carers. We interviewed 20 carers of people who had died from advanced melanoma 2 to 18 months previously. Carers were recruited from 3 of the main melanoma treatment centres in Australia. A flexible interview guide was used to explore the experience of care from the diagnosis of advanced disease through to death and bereavement. Interviews were transcribed and analysed to develop core categories. Our 4 main findings were: firstly, the introduction of targeted and immune therapies has increased uncertainty around diagnosis and prognosis. This has impacted greatly on carers. Secondly, uncertainty was exacerbated when it was unclear which patients might respond to treatment and for how long. Thirdly, carers expected that the new therapies would have positive outcomes for patients. These expectations were often based on media portrayal of the success of immune and targeted therapies. And finally, communication of prognosis by medical specialists was reported by carers as confusing. Often, specialists were not prepared or not able to give a prognosis. So, what does this mean for dermatologists and their patients with advanced melanoma? Our study highlights that the impact of prognostic uncertainty on patient and carer well-being demands ongoing attention from medical specialists, including dermatologists, at all stages of the melanoma trajectory. It is crucial that medical specialists actively recognise and communicate the uncertain benefits of new therapies. Early and ongoing assessment of patient and carer preferences for and understanding of diagnostic and prognostic information is recommended. Medical specialists should clarify and tailor information to patients' and carers' needs and preferences, especially as the disease progresses. In this way, more timely and effective care planning conversations can occur.